I truly believe the reason I'm here, the reason I practice medicine, is to serve others and to help restore trust in medicine and in doctors. That belief didn't come from one moment. It came from years of taking care of people and watching how healthcare is actually experienced. When I first became a physician, I believed medicine was meant to be relational, built on time, listening, thoughtful guidance. But over time, I saw what was happening. I saw how often care became rushed, fragmented, shaped by constraints that actually had very little to do with what a patient wanted or needed. Patients weren't losing trust because doctors didn't care. They were losing trust because the system didn't allow care to feel human. Appointments became shorter and shorter, follow-ups became harder. Patients often left visits without clarity or confidence in what to do next. At the same time, something was changing for physicians. Physicians were burning out, spending more time documenting, coding, navigating systems than actually connecting with the person in front of them. When trust erodes on both sides, medicine stops working the way it should. There's something else that's important to say clearly. Modern Western medicine is incredible at what it's designed to do. If you're having a heart attack, if you need emergency surgery, if you have a severe infection, in those cases, the system can be life-saving for people. That kind of care, it matters, and it has an enormous impact on our lives. But where medicine often falls short, where it misses the mark, is what happens in the decades leading up to the emergency. In prevention, in early signals, in really helping people understand what's happening to their bodies and their health over time. Here's the thing. In modern Western medicine, health changes when a lab crosses a defined line. But really, health exists on a continuum. Long before someone's told that they have a diagnosis like diabetes, there are often years of changes. Subtle changes in energy shifts, metabolic changes, hormone levels. These deserve attention too. And it's not because anyone failed, but because the system isn't designed to slow down, to look at these early signals, or to look at your health that comprehensively. That realization, that's what led me toward integrative concierge medicine. Not as a rejection of modern medicine, but as a way to do it right, to practice it more comprehensively, more individualized. I don't believe medications are the enemy. I don't want to avoid them when they're appropriate. If you have a bacterial infection, you should take an antibiotic. But here's the thing. Prescriptions should be used judiciously. Lifestyle, nutrition, hormones, root cause analysis, those are the foundational conversations that need to happen. They shouldn't be topics that people have to search multiple offices for or have fragmented care to achieve. And as a physician, as a mom, I want medicine to feel steady, grounded, supportive. I want patients to feel safe asking questions. I want them to take time to decide what's best for them. And I really want them to be confident that their physician understands their goals, not just their diagnoses. That's ultimately why I built Ember by Dr. Kelly Brown. Ember exists to create space for trust to be rebuilt, space for real conversations, space for thoughtful, comprehensive care. Much of what's often fragmented across multiple offices and specialists, I've brought it together under one roof with one physician who understands your full health picture. This model isn't for everyone. And it isn't meant to replace emergency care or specialized treatment when it's needed. But here's who it's for. It's for people who want a partnership with their physician, who value prevention, and who want healthcare to feel human again. If you've ever felt disconnected from medicine, disconnected from your doctor, unsure who to trust, you're not alone. And if you're looking for a more thoughtful, relationship-based approach to your health, I'm really glad that you're here. Have a great day.